Good morning, everyone. I'd like to call to order the Diversity, Equity, and Anti-Racism Committee meeting for today, June 18th, 2020.
Roll call.
Members present. I'm going to pass it actually over to Jill for roll call.
Good morning, and welcome to our Diversity, Equity, and Anti-Racism Committee meeting. For those who are new to our electronic proceedings, I am going to provide a brief overview of the electronic procedures. We continue to comply with provincial orders and public health orders and recommendations to support social distancing, as well as prohibiting public gatherings of more than 10 people. This meeting is being streamed live from the Region of Peel website, and we encourage the public to listen to the proceedings online. The people present in council chambers are Committee Chair Downey, myself, and clerks and IT staff sufficient to facilitate the technology and procedures for this meeting. We are conducting the meeting using Webex. If you are dialing in, please note that you will be required to identify yourself so we can update the system with your name. For an optimum Webex experience, we ask that you take the following measures to avoid feedback and confusion with members speaking over one another. Please keep your microphones muted unless you have the floor to speak. Please use a headset and, if possible, avoid using hands-free devices or speakers. Please speak loudly and clearly when you have the floor, and please ensure that any surrounding environmental noise, such as televisions, radios, and pets, is eliminated. The recommended Webex meeting display view is active speaker video view or active speaker and thumbnail video view, so that you will have a full view of the presentation slides and other meeting materials. During a presentation, we recommend that you close your participation list so that you have a full view of the presentation slides. If you are experiencing a poor Wi-Fi connection, please disable your video. If you drop off the meeting, please rejoin. And if you have difficulties, Councillor Committee members are asked to please contact your local IT department first for assistance, following the same process as you do for local council meetings. As required, your local IT department will reach out to regional IT staff for further assistance. We do have community members as well, and so if you are a community committee member having difficulties during the meeting, please send an email to council@peelregion.ca with your issue and a phone number so that a technician can call to assist you. The video function for Webex is activated, so you may choose to turn on your video. It is your choice. You can choose to leave it on throughout the meeting, or you can turn on your video only when you are speaking. If you don't want to activate the video feed, you are not required to do so. We will still hear you through the audio feed. If you wish to speak, please click on the round participant icon on the bottom of your screen to enable your participant list. To indicate your request to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Your hand icon will turn blue when engaged. Members who connect to the meeting via the dial-in option, please send an email to council@peelregion.ca and you will be added to the list. When called upon, please unmute your microphone and proceed. When you have concluded your comment or question, please mute your microphone and lower your hand by pressing the then blue hand to the right of your name in the participant list. Voting is conducted verbally. However, procedural motions and committee motions, such as to receive an item, do not require a recorded vote. Therefore, when the vote is called, the committee chair will call for any objections. If you have an objection, please unmute your microphone and indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. If you have any questions as we proceed through the meeting, please send them to council@peelregion.ca, together with a request to speak. We shall now commence the meeting with roll call. Please indicate your presence verbally when called upon. Member Awani. You're muted. I do see you, so I will take that as being present.
Present.
Councillor Demerla.
Yes.
Member Dio.
Yes.
Thank you. Councillor Dillon.
Here.
Thank you. Councillor Chair Downey is to my left. Thank you. Regional Chair Yanika. Chair Yanika. No. Thank you. Councillor Kovac.
Hi, I'm here. Good morning.
Good morning. Thank you. Councillor McFadden.
I'm here. Good morning, everyone.
Good morning. Member Rokeria. Rafiq, I do see you. I will take you as present. Thank you. Councillor Santos.
I'm here. Thank you.
Thank you. Good morning. And I'll pass it back to Chair Downey. Thank you.
Thank you, Jill.
Madam Chair, it's Mayor Crombie. I'm here today as well. And I can see that Councillor Dillon is on, but can't get himself unmuted.
Yes, thank you, Mayor Crombie. It looks like we have a full house. I'm looking at the screen in front of me, and I see Mayor Thompson has also joined us, and Councillor Starr. So thank you for being here with us today. We have a full agenda and some great presentations, so we'll move through that. Second item, declarations of conflict of interest. Seeing none. Do I need to move that? We'll move on to the approval of the agenda. And we will be adding a letter as item 6.1, communications from BCAN. Do I need to move her in seconder? Can I have a mover for the approval of the agenda as amended? Seeing Councillor McFadden, seconded by Councillor Demerla. All in favor? Or we'll go with any objections. Seeing none. Carried. Item 4.1, delegations. We have Seema Taneja from Taneja Consulting Incorporated and Sharon Douglas, SMD Consulting Inc., here today to provide a presentation regarding equity and equity-based approaches to further understand and create impact for equity-seeking groups across Peel. We welcome both of them, and I will hand it over to our tech support to carry through the delegation.
Thank you so much. Hopefully everyone can hear me clearly. My name is Seema Taneja, and I've been working in Peel and across the province for more than 15 years in areas of data, measurement, evaluation, and community planning. And throughout the 15 years, one constant has always been the need for data. Be it by gender, by race, by ethnicity, by income. This gives us an opportunity to really understand and better serve our clients. Both Sharon Douglas, that you'll meet in just a minute, have the privilege of working on Peel's Community Safety and Wellbeing Plan, and know that the work of the DEAR Committee will be to reflect and to respond to the recommendations being developed through the plan from a regional perspective. We're very encouraged by the motion that was passed last week around systemic discrimination and the regional response. And we hope that today's conversation will sort of help you chart out the what now and the so what of the motion and really create a foundation for meaningful change. At this point, I'll pass it over to Sharon.
Excuse me. Good morning. Thank you, Seema. Thank you for the opportunity to be here this morning. Can you hear me? Am I off mute? Yes? Okay, great. Thank you very much. I'm Sharon Douglas. I've lived and worked in the region of Peel for over 25 years. As Seema said, we are privileged to be part of the community safety and well-being strategy. I'm now doing freelance consulting, and previously had been the director of community investment at United Way, then Peel region, now United Way Greater Toronto. So we're delighted to be here this morning. We're ready for the slides? Or is it that I can't see? There we go. So this morning we have the opportunity to delegate and speak to you around advancing equity in Peel region. Next slide, please. And many of you know, given the current circumstances and the global uprising, or response, I should say, to what has been happening in the last few weeks, Just a reminder that it is a legal responsibility articulated and supported and mandated by the Canadian Human Rights, the Charter of Rights and Freedoms, the Federal Employment Equity Act, and the Ontario Human Rights Commission. Advancing equity and putting forward issues of equity and addressing them is a moral responsibility. It is the right thing to do. We've seen that. I think George Floyd gave us all a moment of pause, and we realize it is time for conversation. We're beyond that, actually. Having equity in place increases innovation, provides opportunity for better decision making, as it brings different perspectives, different experiences, and different histories to the table. There's an absolute increased employee engagement, productivity, and commitment. And of course, as a community and as a municipality responsible for a large community, it increases access and inclusion. We're able to create that sense of belonging that us in the sector often speak about. How do we increase belonging? How do we increase participation in the community? Through advancing equity, we're able to do that. Next slide, please. So I think everybody feels and knows at this point in time, it's time for action. In Peel, we've done a lot of research. There are many, many reports out there. It's time for us as a community to face those who have been othered, marginalized, and oppressed, and have been failed by a system that was not designed for the current diversities and realities in Peel. It is time to move beyond the guilt, the shame, the discomfort, the inertia, and the patronizing voices that say this process takes time. I can tell you, I've been here. I've probably been part of almost every equity strategy going on in the region. It takes time. It is not about a personal attack. It is about creating a fair and equitable playing field. It is time for principled action. It is time to eliminate the current systems that unfairly advantage dominant groups, those who hold the power and have the privilege. The region of Peel, as we all know, have changed, but our policies and procedures have not changed to match that. And how they play out on the ground in practice sometimes is far different from what the policy is. It is about the disconnect. I think when we all began equity training and equity policies and inclusion, training was the panacea for everything. But training has not taken us there. Everybody has DEI policies, but the reality is different on the ground. So where is the disconnect? If every organization in the region can say, we have a diversity policy, we have an inclusion policy, we have all of these things in place. I've been trained. I bet you everybody on the phone has received some sort of equity training. But yet this morning, I'm here, or we're all here having this conversation. So where is that disconnect? I think that's important. And then it is time for us to collect and share data. I'll now pass it over to my colleague, Seema.
Next slide. Thank you. I think really what equity-based data allows us to do is understand the who, right? Understand who our clients are. This data gives us the ability to plan our programs and services to meet their unique needs. It also tells us who's not accessing our services, which allows us to then examine the inequities that may exist in our services and our practices and policies, like Sharon said, and our outreach strategies. So when equity-based data is collected, we can really begin to answer the questions that we've been asking ourselves for years, which is, are there really differences in experience and outcomes experienced between, for example, Caucasian female youth and South Asian female youth in employment programs? Or do bisexual Indigenous women suffer from poorer health as compared to heterosexual men and women? If so, this understanding really allows us to shape and create programs to meet the needs of these individual populations, or we can adapt our current programs to ensure all diversities are being set up for success. We must ask, how do different groups access and navigate the full range of services the region of Peel provides? Collecting data on characteristics of service users is a vital tool in designing equitable and effective services. We know that the evidence shows that there are differences and people's experience differs based on outcomes such as income, ethnicity, ability, and gender. So collecting equity-based data consistently across the region and regional programs enables us towards social change and the real impact that we want. And also throughout this learning process, we need to ensure that we monitor if our intentional and informed changes to our programs are removing barriers for all diverse populations. I want to take us to this last bullet. We do know that we have robust population-level survey data that's helped us identify many forms of inequities in sectors such as health, housing, employment, education, and the list goes on. Yet there's still a lack of standardized and routinely collected sociodemographic data at the program level. And really what this does is it hinders our ability to assess organizational performance and identify improvements for reducing inequities. Next slide. So as we know, Peel has undergone massive transformations in what its population looks like, and there has been a concerted community push for greater recognition of all forms of diversity. While our communities have experienced deep-rooted change, I think we can say our systems have not evolved at the same pace. If you could turn your attention to the stats on the slide, and I want to ask us a few questions. When I take a look at these stats, a few questions come to mind. What should this data tell us? Have we used this data to ensure we're resonating with our clients? Have we provided staff with the information, resources, or training to meet residents or students where they're at? We're still asking these questions. What disaggregated data allows us is it gives us really the opportunity to take appropriate and effective actions that can bridge the gap in representation, create targeted interventions for equity-seeking groups, create culturally relevant services, and guides us to community organizations we can collaborate with, and also helps us develop strategies that resonate with our diverse communities. Next slide. Thank you. We know there's been several Peel-based reports, as Sharon mentioned, dating back to 2016, if not earlier, that recommended the need for disaggregated data, so targeted interventions and supports can be provided. This data, and if made available, so if it's collected and made available, could have supported to the creation of targeted interventions and preventative programs that could safeguard our communities from crisis-driven programs. This is really aligned with the Community Safety and Wellbeing Provincial document that speaks to the need for more focus on upstream programs and approaches that can really lessen the burden on downstream costly interventions. Next slide. I want us to read the bullets below and think about the impacts we could have in our community if we knew this information. This data is power. Power to understand the realities of our residents and clients, the power to understand how life outcomes differ, right, based on all the dimensions of diversity, and the power to create equitable spaces, services, and programs. Without equitable interventions, there will continue to be a disproportionate impact on Peel's equity-seeking groups. There are so many possible effective interventions like the evidence tells us, but only with an understanding of the disparities can they best be selected, implemented, and evaluated. Sharon, over to you. Next slide.
Thank you, Seema. So today we're here to say, to gain the benefits of diversity, equity, and inclusion, there must be serious investments in organizational transformation. There has to be a commitment to an intentional and deliberate focus in order to action all of the recommendations brought forward previously in order for change to happen. Policies, procedures, and practices must be reviewed through an integrated anti-racism lens. An integrated anti-racism lens includes a component that focuses on anti-Black racism. Though tasks, and I want to mention there, I was really surprised, pleasantly surprised, and excited to see the motion passed last week that Seema referenced, and I thought this is a very good beginning, but it's time for us to move to action. We've been at this for a long time. And as Councillor Starr said, we've been back when we had the Diversity and Inclusion Committee in Mississauga. So it's time to move to action. Those tasked with the responsibility of leading this work must be given the support and authority to make change happen. As we look at our regional organization as a structure, those leading that work internally and externally need to be able to have all of your support in order to move the marker on this. Milestone markers built in for accountability, transparency, and consequences. We have an opportunity here to be proactive and to be responsive and to reduce incidents where we are being reactive. Again, that fits in with the language of the community safety and well-being strategy. The system must be, all of these things are here. Can we slide that up a little? The system must be rebuilt on the principles of social justice, equity, and equitable outcomes. And then annual report we put out regionally, Community for Life, must have a component that actually speaks to what change has happened, and we can share it with our residents at large. I think that's our last slide. Thank you very much. Is there another one? Thank you very much.
Thank you, Seema, and thank you, Sharon. It was a pleasure having you with us this morning. We do have some speakers on the list. I'll go to Councillor Santos.
Thank you, through you, Chair, and thank you very much for this presentation. I just wanted to bring up a couple of points, and I'm happy to move the delegation as well as the report itself. I'm going to admit that in the very beginning of COVID-19, when we were talking about data and very specifically about race-based or geographic data, I was reluctant to release that info, or reluctant to support the releasing of that information, because I was scared of the racist comments that and discrimination and comments that may occur because that data is released. And what I'm finding now throughout this whole entire process is, number one, we just have to acknowledge that there is racism here in the region of Peel, and we can't be afraid to uncover it. And whether you are a person of color or if you are not a person of color, we have to be okay with the discomfort of acknowledging that the racism exists as a first step in order for us to actually proceed and move forward and deal with some of the inequities, including the health inequities that exist here in the region of Peel. And so I fully support the recommendations and everything that you have presented. And appreciate that Councillor Downey has put forward last week the recognition that we are in a crisis right now. And with the crisis, I'm happy to see that all three mayors are here joining us at this very important committee meeting today, Mayor Crombie, Mayor Thompson, as well as Mayor Brown, who don't have to be here today, but they are here today because we have declared that crisis. So happy to move the delegation and also the recommendations, but also want to point out that if we want to continue this conversation and if we do want to take action, that we should look at as well how often this committee is meeting. Because right now, I believe our next committee meeting might be in August or September or something later into the future. And I do think that we need to be meeting more often, especially if we will be collecting this data and discussing this data and what that means. This particular committee will have a very important role to play on behalf of the Regional Council moving forward. So in addition to the recommendations that are in the report, as well as bringing forward and accepting the delegation, I would also recommend that we discuss and move that we meet more often, possibly at least once a month on this committee in order to deal with the crisis itself. Thank you. I'm not sure if staff or if the delegate would like to comment in response.
Sharon, would you like to comment? Or Seema?
I, of course, second the motion. If I have that authority, I think I'm very happy that our three mayors are present. I've seen all of them, participate in many different ways for years. And so I'm happy they're here. I'm happy that, I'm not really happy, but pleased, that we've declared anti-Black racism a crisis, that the impact of health, that there is an interest right now, and that it's not a trend, but that it becomes something real that we actually turn into positive action, that we as a regional municipality of Peel can actually lead the way on these conversations and changes that are happening, and that our community members are not feeling like they don't belong. And they shouldn't feel that way. They don't belong. It's very simple. And I could tell you many stories, but we don't have time. So thank you for the opportunity.
Thank you, Sharon. I'm going to go to Juliet for comment.
Thank you. Through the chair, we will absolutely take a look at our schedule and revise under the circumstances to ensure that we are making this a top priority.
Thank you, Juliet. Mayor Brown?
Take myself off speakerphone. I want to echo some of the comments that Councillor Santos said. The concern initially was that it may create a stigma, but I really believe that transparency is our obligation, because otherwise we can be accused of sweeping problems under the carpet. And if we collect this data, we owe it to the public to be transparent with it. And if anything, I'm glad during COVID-19 that we've been collecting this data, but I have been a little frustrated that we haven't been forthright in actually releasing that data. And maybe it takes time to compile and explain, but I really think we need to do everything we can to be as transparent as possible. And so I'm glad, Sharon, others, and Juliet, that you've echoed that, and I think it's very important. So I just wanted to add my voice to the record.
Thank you, Mayor Brown. I too agree. I was hesitant regarding the heat mapping for COVID, but I think that it's important that we use this data as a learning tool to really look at our communities and the disparities among them. I thank Sharon and Seema for being here. Sharon, one of the points that you made in regards to action is that the action is principled. And I was really encouraged by your presentation, and I appreciate that. I talked to Sophia Brown Ramsey this week, and one of the things that she said that stuck with me is that we need to make sure this is not just a moment, but a movement, and that we continue our work, and that we do it in a way that is guided in principle, and that all of our community stakeholders are using that same, those same fundamental values as we move forward through the work. If you think of the region as a family, I was really encouraged this morning. I had an email at about 8 o'clock this morning from the Peel Board of Education, not in my role as a council member, but as a parent. That email came through, and the Board of Education has turned over their direction to the Ministry of Education to move through this work, and that was really promising for me. So I appreciate that all of our community stakeholders are really focusing their lens on these issues, and that we're doing it all from the same page. Sorry, now that I'm speaking, our speakers list is growing. So Rajbir, go ahead.
Thank you, Sharon and Seema, for that presentation. There's a few points that really stuck out to me, and I would like to just elaborate a little more on them. So you're talking about collecting race-based data. Excellent, we need it. And I like the different types of data you pointed out within race-based data. For example, you mentioned collecting data on ethnicity and, importantly, ability. So that really stuck out to me, because we know that there are someone's abilities, particularly I'm speaking about mental health issues, can cause significant different types of outcomes for them when they're interacting with the system. Particularly, for example, we know that the police do deal a lot with individuals in the community who are having mental health crises. And we talk a lot about things that are happening in the States, but there are also many cases right here at home in GTA, in Region of Peel, where there are situations where police are getting involved with somebody who's having a mental health crisis, and there are deadly outcomes for that person. And there was a situation like that just a few months ago. I was reading about it in the news, where a young Black man himself had called for help. He was having a mental health crisis, and police officers arrived at the scene, and something happened, and that man ended up dead. So this is why I think it's very important that when somebody is racialized and on top of that, they're also having a mental health issue, this is like a double whammy because both these things, both mental illness and being racialized, have lots of stigma to them. So that's why I really support collecting this data, especially on ability, because you also pointed out how this data is important to developing preventative programs. And perhaps with mental health and whatnot, if we have those preventative programs and funding allocated to the appropriate areas, then we won't get to these crisis situations. And also, we have to do better at responding to these crisis situations. Is there de-escalation going on? Rather than, because if somebody's having a mental health crisis, we know that we need to have a de-escalation attempt to deal with that person, especially when they themselves or a concerned family member is calling for help. And just to show the kind of interlinked nature of all this, we're talking about preventative programs and we're talking about healthcare, getting people care for their mental health, for example. There was another article came out a few months ago from the concerned doctors who mentioned concerned doctors of Ontario who mentioned that they had concerns about institutional racism playing a part in hospital funding. For example, in Brampton, hospital funding that Brampton gets is $937 per person. The Ontario average is $2,000 per person. So it's $1,000 less per person. And I guess my question is, what can regional council do? What can we do to ensure that these gaps are addressed, these barriers are addressed, so people in our community can get the services they need?
Is she on? I'm going to look to Commissioner Sheehy potentially to respond to your comments, Rajbir. Or Commissioner Granger.
Thank you. It's Kathy. I'm happy to respond. Thank you, Chair. Yeah, last week at Regional Council, we did bring forward a report and a presentation on mental health and addictions. So thank you for your comments. We agree that this is an urgent issue that needs to be addressed. There was lots of support around Regional Council to advocate strongly for equitable funding in the region of Peel. So we have brought back, we are re-looking at our motion to do some stronger advocacy in this issue and to look at overall healthcare to support mental health and addiction. So I agree with your comments, and we will be bringing back a stronger motion and enhancing our report next week at Council. So we agree with you, and we will continue to address this issue. We also address this issue, it's one of our priority issues at the Community Safety and Wellbeing table. Thank you.
Thank you, Commissioner Granger. Seeing no more speakers, again, I'd like to thank Seema and Sharon for joining us this morning and for their presentation. I will also, just through Councillor Santos, will move receipt of the delegation and that separately. And together that we can, as a committee, endorse the delegation's call to actions. And we'll have Rajbir, will you second that? So Santos,
yes.
Okay. Any opposed? Motion carries. Thank you. Okay. Moving on to reports. Report 5.1, equity-related issues impacting racialized and vulnerable communities. This is for information and related to 4.1. Councillor McFadden?
I'm fine, Chair Downey. Sorry.
Councillor Santos?
I meant, I thought we were already at 5.2. I apologize.
If there are no speakers, we'll move for receipt. Councillor McFadden, thank you. Any objections? Item carries. Moving on to 5.2, update on the Region Appeals Diversity and Inclusion Strategy, also for information. And we'll go back to Councillor Santos.
Thank you very much. I just wanted to point out, and I'm trying to pull up the report as I scroll down on this one. Where is it? 5.2. I'm going to have to work by memory now. So I believe it's 5.2-2 on the page at the bottom when it talks about risk considerations. There's a very specific line that talks about if we don't continue our work on the strategy, that the region has reputational risk. And so I appreciate that there is reputational risk, but I also wanted to just highlight that when it comes to implementing diversity, equity, anti-racism strategy and plans, that it has to go far deeper than just reputational risk. And so I wanted to just publicly share that because it is more than just a reputational risk here with respect to moving on with our plans and procedures as was presented. And I think that as the region of Peel being one of the most diverse municipalities across the country, we should be taking a lead. And so moving forward, let's just not limit our language when it comes to these topics as reputational risk. That's all. Thank you.
Do staff have any comments?
Sorry, I was trying to put my hand up. It's Juliet Jackson. I apologize. Absolutely agree with that. We really wanted to kind of emphasize that we need the commitment to focus on the community and the impact on the community, but we also need to understand that remaining silent or not really pushing forward with this will reflect badly on us, because we do, have one of the most diverse communities in North America, actually, and it is time to act and to really make a difference and to lead. So, in complete agreement. Thank you, Councillor Santos.
Thank you, Juliet. Seeing no further speakers, Councillor Santos, would you like to move receipt of 5.2? Thank you. Any opposed? Carries. Moving on to item 5.3, update for community safety and well-being plan for information. Is there a presentation with that? Would anybody, just a call for comments from staff or questions? Seeing none. Moved by Councillor McFadden. Any opposed? Carries. Was that? Okay. Item 5.4, multicultural media strategy. Also for information related to 5.5. Councillor Santos.
Thank you. Through you, Chair. Under 5.4, and I'm trying to find the presentation slide for it, where there's a recommendation to be moderate. There it is, moderate plus a proposed approach for Region of Peel. In the second bullet, it says that media releases are translated by request to ensure timely delivery. I'm wondering, and I know that there's another section about the improvements to translated material. I'm wondering how and why it would be so difficult just to automatically translate our media releases in the top 5 languages in the region of Peel. And I share that because understanding ethnic media, many of them, if you give them pre-translated material as a media release, they're just begging for content, and they will just publish your media release if it's already translated for you into their publication. So just wondering if we can push more, or if there's a reason why we are asking the various media sources to make those requests versus us just proactively translating it for them.
Lisa, would you like to comment on that? Sharon, there she is.
Can you hear me?
Yes, go ahead. Oh, now you're muted again, Lisa.
Goodness, sorry. For my first time with Webex, it's all a new experience. Thank you for the question, Councillor Santos, and through the chair. We have struggled a little bit with translation in Peel, which is, is what it is, but we're correcting it now. So in the past, we had tried to translate some documents and we didn't get it right. So we, I think out of fear, stayed away from that. I have had some discussions with ethnic media outlets of late, and they have even offered to do the translation for us if we provide it to them in English. So I think your question is really valid, and I think it is something that we should be exploring. Our practice in the past was just to get it out as quickly as possible in English, but we are missing a large segment of the population in doing so. So certainly happy to take that back and factor it into our communication strategy.
Thank you so much, and I think we should consider it. Obviously, there would be costs associated with it, but I saw that there's already a budget of $20,000 specifically for translation. And if it's there, I mean, let's just make it easier for them. A lot of these ethnic media sources are struggling right now, and they most of them operate as volunteers. And if we ask them to translate our material, then we lose control over what that translation becomes. And if we make it easier for them, for the most part, they will just publish the press release, which is amazing. So if we can take that back and look at, I'm just saying the top 5 languages across the region of Peel, but if we could look at that and just make it a little bit easier to get our message out from the region, because the easier we make it for them, the more likely they're going to publish it, and the more likely we're going to be able to get our message out as a region. Thank you.
Absolutely.
Thank you, Councillor Santos. Councillor Dillon?
Sorry, Chair Downey, can you hear me?
Yes, go ahead.
Thank you. So I just want to say I agree with Councillor Santos. We live in such a diverse region with so many different languages. And being a Punjabi, I know that in Brampton, there's probably 30 to 40 radio stations. There's probably 20 to 25 newspapers that either operate on a daily or a weekly basis. And what they do is they have translation services, but that goes back to the home country, for example, India. And so if they want to get something translated, it might take a couple of days. And so if we do send it already in that language, it's a greater chance that they'll be able to get it in on time, and B, posted in the newspaper. As Councillor Santos mentioned, it's majority of the time they usually just post it as is, and so there's so many different people of different backgrounds that read their ethnic newspapers, and I think it's a good opportunity for us to really get our message out to them. And so I think it's a great idea. Hopefully we can look into that a little bit further.
Thank you, Councillor Dillon. I agree, and I think that that can be taken as direction through communications. I'm seeing nodding. Thank you. Councillor Dillon, would you like to move receipt of 5.4?
Yeah, sure.
Can we put 5 and 5.5? Okay. Any opposed? Carries. Moving on to 5.5, improved access to translated material. Unless there's any questions, I think we've discussed it. Seeing none, moved by Councillor Santos. Any opposed? Carries. Moving on to communications, added correspondence from the Black Community Action Network. It has been emailed out to the committee. You may have it in front of you as it was received this morning. And I believe Councillor Santos would like to speak to this.
Thank you. And I know that folks have just received it from the clerk. This is a response from the Black Community Action Network of Peel, providing some recommendations and important call to action based on the motion that Councillor Downey put forward last week. And I'm not going to talk too much about what I think we should be doing because I am bringing forward a motion to accept and to endorse and to direct staff to bring forward or to work on the various calls to action that BCAN has put forward. So again, this is about us walking the talk when it comes to declaring a crisis here in the region of Peel. It has to do with us as a region taking a lead and not waiting to see what other municipalities are going to do. And it is about us taking the lead together in solidarity with the Black community in what they are asking us to do. And when Councillor Downey and I were discussing it together before this meeting, like just before this meeting, minutes before this meeting, we were both in agreement that I don't think it's necessary for us to bring this back to staff for a report back on how we would implement these recommendations from BCAN, because we've already made a commitment that we're going to work with the community, and BCAN is a significant piece of that community and a significant voice of what the community stands for. So I just think that we should just move. And so there is a motion that is consistent with the calls to action that BCAN has put forward in this letter in response to Councillor Downey. And I'm not sure if the clerk has capacity to put it on the screen, but it is essentially, it's a duplication of what BCAN is asking us to do.
Thank you, Councillor Santos. We will have it up on the screen shortly. There you go. I'm going to pass it. Oh, actually, Councillor Dillon's on the list to speak. I can have clerks read the motion.
Thank you, Chair Downey. I have emailed the motion to the committee and members who are on our meeting here electronically. However, I will read the motion. Whereas the Council of the Region of Peel passed a motion on June 11th affirming its commitment to address systemic discrimination by supporting policies and programs that address the inequities that the Black community and other marginalized groups continue to experience within Peel. Now, therefore, be it resolved that the implementation of all calls to action should be based on fundamental core values and principles, including race equity, sustainability, continuous learning and accountability, co-design and shared responsibility, community capacity building, and innovation. That the Region of Peel should conduct an inventory of internal organizational activities related to anti-Black racism in order to ensure future implementation efforts maximize the potential for efficiencies and synergies and avoid duplication with current scope of work. that calls to action be implemented in a comprehensive and integrated way through the development of a multi-sectoral, community-based initiative to address the social determinants of anti-Black racial health inequities. That the model for such an initiative should incorporate principles of co-design involving shared responsibility for service planning and resource allocation, similar to the Human Trafficking Service Provider Table. The initiative should prioritize the equitable funding and sustainable capacity building of Black-focused organizations and build on synergies with existing initiatives in the region, including but are not limited to the United Way of Peel Region's Black Youth School Success Initiative and BCAN System Leaders Roundtable. And further, that the implementation of call to actions should involve extensive consultation and co-design with stakeholders of the Black community in order to ensure public education efforts accurately and sensitively reflect the issues of anti-Black racism. Public education strategies should use a range of innovative social marketing approaches, such as, but not limited to, web-based campaigns, documentary, arts, special events, community town halls, 21st century community talk shows, and can involve various stakeholders, including the private sector and our allies. Again, the motion has been sent by email. Thank you.
Thank you, Jill, and I apologize. Councillor Dillon was on the speakers list. Councillor Dillon, would you like to speak to the motion?
No, sorry, my hand was still up from before. Sorry.
Thank you. Do we have any speakers to the motion? Rajbir, go ahead. Rajbir, you might be muted.
Hi, can you hear me?
Yes, go ahead. Thank you.
Okay, thanks. I just wanted to say that a key point from that letter that stood out to me was mentioning social determinants of health. And the social determinants of health include things like, age, gender, race, access to food, housing, education. And using a social determinants of health perspective is really important when we're trying to tackle systemic racism, any type of systemic discrimination. And there is research that actually indicates that your social determinants of health have a greater outcome on your health outcomes than your actual genes or conditions. So the social determinants of health play a bigger role in determining your health outcomes than your actual condition. So that's why it's really important when we talk about equity, to make sure that everyone is social determinants of health are being adequately addressed, because that's how you help the health of your community. So I just wanted to make that point. Thanks.
Thank you, Rajbir. Point taken. I think we all, look to the social determinants when we are applying the lenses to our work, and recognizing that foundationally the best way to work through these systems is, for the future is upstream measures as opposed to managing acute. But obviously we have to do both, and we appreciate your comments. Thank you. Seeing no other speakers, moved by Councillor Santos, seconded by Councillor McFadden. Any opposed? Motion carries. Thank you. There has been no indication of other business under item 7. Is there any calls for other business? Seeing none. No in-camera matters. Item 9 is the timing for our next meeting. However, we've moved to look into having more regular meetings. I'm seeing nods across the board. So I think we'll have to come back with direction to staff for committee to look at a consensus for, I would say, monthly meetings. And that would be reported back to the committee shortly. Yes? Okay. All right. Councillor Dillon, would you like to move adjournment? Councillor McFadden, thank you. Thank you for joining us today. Thank you for the discussion. Meeting is adjourned.